Hi everyone, my name is Antonia and I have prepared a presentation discussing the importance of incorporating nutrition behavioral changes addressed by Task Force with a closer look at three of them. As we know, obesity is a disease affecting more people every year worldwide, and the White House has decided to take steps to reduce numbers in the future in US. So one of them is public health and education domain, which is number 8, and is the need to improve readability, content, and usefulness of packaged food labels to make it easier to identify more nutritious food options, both within and across food categories. So food labels change every time once in a while. FDA required all products to change their labeling last time by January 1st in 2021 to make it more visible and useful for consumers. New labels increase the visibility by larger and bolder fonts for serving portions and calories. There was a new nutritional value added, which is added sugars. Another change that was made was deleting vitamins that are not deficient in population, such as vitamin A and C, and instead the vitamin D was added because this is usually taken in insufficient amounts by population, and many people spend time at homes, so they don't get enough energy from the sun outdoors to uh, make it possible for their bodies to create their own vitamin D in organism, as well as potassium was added because values for potassium in people uh, are low from the consumption. And recommendation for potassium intake is to substitute sodium to potassium electrolyte as a part of foods because uh, potassium is usually very high in values in processed food, and potassium can be added to foods instead of sodium. Also, one drawback of US food labels is that they are on the back side of foods or often on the not very well visible areas at first sight, and can be misleading or not well understandable by wide population. It is scientifically proven that people consider nutritional values of food when buying items, and well visible labeling was shown to be a good intervention for reducing obesity. Increasing literacy about food, content, labeling, making font size bigger, and placing food labels on more visible places, most possibly to the front, are needed to make nutrition facts about food more useful and impactful information. Scientists from Clinical Nutrition ESPN considered Chilean labels as an example, which would be better and more useful in US since there are warnings of high calories, for example, or sugars, or when food is high in sugar content on the front side, as you can see on the picture. But this solution may not be favored in US by producers as they try to make design of packages stand out rather than nutrition facts about the food. So the second one is from healthcare domain, number 14, the need to increase access to and insurance coverage for behavioral intervention and nutrition counseling to improve diet and health. So it is widely discussed topic that healthcare system in US is not set equally for every socioeconomic group. People with higher income are able to afford paying for insurance covering most of possible treatment with any health-related situation. But people from lower incomes are often not insured at all or uninsured. And this is a big problem in the US because healthcare and appropriate healthcare is not affordable for everyone, which also includes problems with treating obesity. And also since obesity is mental cause, not only physical cause, the difficult to and it's very difficult to manage disease mentally and emotionally. Nutrition counseling and therapy were proven as very helpful for preventing or reducing obesity. There is need in US to modify health care insurance system, and Europe can be taken as an example where we would make it more affordable for every individual so people would have access to medication and therapy. Another problem with healthcare in US is that obesity stigma is prevalent and obesity also among doctors and medical personnel, and obesity related training is non-existing or is very low priority in most medical schools, and most obesity management training uh, provide only theoretical and not practical training, how to communicate and help patients with obesity to feel better and actually help them from the medical side as well. And as said in the International Journal of Obesity, state and federal level policies change is necessary for improved obesity care coverage. Without a reimbursement, medical personnel are always likely to seek training and provide obesity-specific care, as well as inadequate healthcare coverage also limits treatment options when anti-obesity medication are not covered by health insurance plans. Nutrition counseling and therapy are often excluded from insurance coverage, making them very inaccessible for patients, even though approach, self-image, and behavioral changes are necessary to change lifestyle and reduce obesity. And the last one I will discuss today is from the healthcare domain, the number 20, the need to utilize research and data sharing to improve nutrition policies and programs across federal agencies. Government and policymakers are aware of obesity, which is being a big problem that need a solution, where interventions have to be embedded in laws and policies to make changes work. Obesity being also a health problem with variability in every individual, and states or national government may have the right to implement a policy, though, even though it's a health problem, scientific research, data analysis, discussions, testing, communication, and cooperation of professionals are necessary part of being successful in reducing obesity and implementing successful interventions. For example, FDA or US dietary guidelines are science-based and are already useful tool for nutrition management for everybody. US is one of the countries leading in numbers of research and testing done, though there is still lack of evidence on many topics or a lot of bias, and these need to be tested or approached from other perspectives more. One example can be, for example, longitudinal studies which take years or generations to bring results, which is one of disadvantage of long-term studies. In addition, international research here grew up in past years, but there is always room for more information exchange and improvement among countries, and certain countries don't contribute to research as they do their own experiments, which is slowing worldwide progress overall. For example, China, they do research, but they are very close to other world and they do their own testing, where the rest of the world has usually no idea about, and if they were sharing the information, it might be very useful for other sciences to work with the data already collected or their ideas. And development of technologies make it easier and faster to gather, analyze, and exchange data. And it is expected that advancement in this sector will make research more effective and faster in the future. And as mentioned in an article from a journal named Circulation, focusing on nutrition security, future advocacy, innovation, and research will be needed to expand and strengthen existing policies and programs and to develop and implement new policies and programs that improve nutrition and health and reduce socioeconomic and racial or ethnic disparities in chronic disease and obesity. So we can conclude that research and science are the leading progress to assessing strategies for effective weight loss and weight gain prevention, but politicians are a necessary part for incorporating these strategies from research and science into everyday life through policies to make it work. So both parts are necessary and important. Thank you so much for watching. I hope this was very helpful for you, and these are my references I was using for my presentation.